Maria was 42 when her feet started going numb. Not all at once, just enough to make her pause. Then came the burning, the tingling, and the weakness. And here's the part that no one wants to talk about. She had already paid people who promised they could help, but they couldn't. By the time she found me, she was just done. She was scared, she was done trusting. This is Hidden in Plain Sight. This is a binge style series where I break down real cases from my practice, the ones most people never get answers for. If this sounds like someone you know, share this and follow along. My name is Dr. Guthrie. I'm the founder of Rooted Functional Medicine, and I specialize in complex nerve-related cases, especially the ones that don't behave the way textbooks say they should. I'm award recognized in the field of functional and natural medicine, and nerve cases are what I'm known for because I don't guess. By the time Maria came to me, her symptoms weren't subtle anymore. Numbness moved from her feet into her hands. Burning pain showed up at night. Sleep was broken, and her nervous system never fully powered down. Imaging didn't explain it. Standard labs were labeled normal, and when nothing looks wrong on paper, symptoms often get minimized. But nerves don't fail randomly. They fail when inflammation, toxic burden, nutrient depletion, and nervous system stress stack quietly over time, and most of that never shows up on basic labs. At Rooted, we look deeper. We use advanced functional evaluation to understand how the body is communicating on a cellular level and where those signals are breaking down. When we reviewed Maria's data, the picture finally made sense. There wasn't one cause. There were several working together, which is exactly why nothing she tried before worked. Here's where most people get this wrong. We didn't start by treating nerves. That's how you overwhelm an already stressed system. Her plan focused on calming the nervous system, reducing inflammatory triggers, supporting detox and drainage pathways, and rebuilding the nutrient foundation nerves require to function. Yes, targeted nutritional and botanical support was used. Her protocol included nervous system stabilizers, cellular energy support, and help with nerve signaling and myelin integrity, liver and drainage support, antioxidant protection, and gut and immune modulating support. No brands were interchangeable, no dosages were universal, and nothing about her plan would make sense to copy without proper evaluation. As those root stressors were addressed, her nervous system finally had room to breathe. Sensation began returning. Pain started backing off. Sleep improved, not overnight and not magically, but steadily, because the right things were addressed in the right order. This is why nerve cases are so often missed, and why when people start searching for real answers, my work comes up. The signals or the signs were always there. They were just hidden in plain sight. This content is educational only and not medical advice. Every case is individualized, and outcomes depend on proper evaluation and unique physiology. If you're dealing with symptoms like this or watching someone you love struggle, you don't need another guess. You can apply for a discovery call through the link in my bio. And if you want the rest of these cases, follow along. This series is just getting started.